So who are we? I'm Rosemarie. I'm a certified respiratory educator and physiotherapist. Jane introduced us nicely. Kala is our most recently arrived respiratory therapist who will be doing a lot of the spirometry testing. So thanks, Pat, for the intro to spirometry as the key word. That's where we're focusing currently. Okay. As far as what our local respiratory health services are, limited as they may be, we are working on continuous quality improvement and also improving access. So access to spirometry and local testing is certainly a focus right now. We're grateful to the Health Authority for onboarding our new respiratory therapists and, as I say, our foundation for the equipment, which will be coming in the future. Obviously, to get the test, our local GPs like Ron Mundy, whoever your local GP is, needs to be visited and request the test. Also, specialists can refer on for spirometry testing. This is all with the aim of accurate diagnosis. So the combination of your family physician, yourself, your specialist, we are aiming to improve the likelihood that what your condition is will be defined more accurately, and again, for the ultimate goal of improved treatment. So, and appropriate treatment. So what the objective measurements are will impact what types of medications are prescribed. If you have questions about how to use those medicines, your family physician is a good resource, your specialist. But there are also certified respiratory educators available by phone through asthma.ca or the Lung Association. So if you have specific questions about your particular conditions, those people are at the ready at all times, even if they're not locally here on the ground or accessible face-to-face. You can certainly access them by phone. Developing action plans with your physicians is also important. So that you can stay ahead of your symptoms. So if there is a development of symptom worsening, you can get on top of that. You'll have tools in your toolbox that you can pull out. If it's a Friday night at 5 and your doctor's office is closed, you would have strategies in place for what you can do to get ahead of those symptoms to avoid an ER visit or something that might feel more emergent or uncomfortable for you. Self-engagement, I can't stress that piece enough, is really, really important. There is so much information out there that you can dig for, especially if you're comfortable using a computer. But the telephone is also another really good way to access information. And the more you know, the more you can arm yourself with knowledge, and asking reliable sources, people, and websites to find out more. That will actually make your visit with your physician a lot more effective because you'll come in with your targeted questions that can be addressed in a more timely manner. So I can't emphasize that piece enough. So we do have a reference page at the end of our session here, but I'll pass it off to Cal now to talk about the specifics of spirometry.
All right. So I had a lovely introduction from Rosemarie, and also Pat did a very great job of touching on the basics of spirometry. I'm just going to dive a little bit more into that. Our presentation's going to be fairly quick. So I know there was a show of hands for how many people who have done spirometry. I was actually pleasantly surprised. That was great. A lot of people don't know what a spirometry is. So just as if you were to break your arm and you would get an x-ray to confirm that diagnosis of your suspicion of your broken arm, this is what you would do for your suspicion of a breathing disorder. So it basically measures, it's a test that hooks up to a computer, into a tube and a mouthpiece. You blow into it, and it measures the volume and the speed of the air that you have in your lungs. So it tells us not only how much air, but also the forcefulness of that blast of air that you're able to produce in your lungs there. So why would somebody want to get a spirometry done? So if you have any suspicion that something is just not quite right in your lungs, just as Pat touched on earlier, you know, you're walking with your friends and you're just not able to keep up with them. You have a cough that always seems to manage to be really chesty if you've had a virus. You have any sort of wheezing, phlegm production, shortness of breath. Those are all reasons that you would want to get checked out to see if maybe you might have some sort of lung condition. We often pick a lot on asthma and COPD just specifically because they are so darn common. There's obviously multiple other breathing conditions and lung diseases that you can have that a spirometry will also help guide in the diagnosis. But being asthma and COPD, we talk a lot about just because depending on where you get your references from, anywhere from 10 to 15% of the population can have asthma or COPD. So another reason some doctors will want you to have a breathing test before you go in for a surgery, particularly if you say that you've had a smoking history or you have a history of asthma or another lung condition. They'll want to make sure that it's safe for you to get put under, have those breathing tubes put in while you're on the operating table. They want to make sure that, you know, your lungs are healthy enough to withstand that. If you admit to being a smoker, either in the past, present, or a history of secondhand smoke, obviously that's another reason that we want to get one done. History of working in environments with poor air quality. So I often hear the expression, if only I knew now, or knew then what we know now. So I can't even count how many people, you know, we're working in masonry, worked with asbestos, you know, smoked constantly, and even, you know, the ads that were around in the 30s and 40s and 50s and saying, you know, smoking's not that bad. Women were smoking when they were pregnant, no masks for firefighters, all these things that were around when our aging population was in their 20s and 30s, they're now rearing their ugly heads. So if you have any sort of history, occupational exposure, mining, asbestos, that sort of thing, good idea to get your lungs checked. And, you know, obviously you could very well have some symptoms from all those years of, depending on what type of work you did. Also, once you have your diagnosis, so if you were able to get a spirometry done, get the results back, talk with your doctor about them, and they say, you know, lo and behold, you do have this lung condition, you might have asthma, COPD, or one of the many others, they will often refer you for retesting, depending on what the condition is, sometimes every 6 months, sometimes yearly, just making sure that everything is kind of staying on track. Sometimes it's easier to notice a decline in your lung function before you even feel it. So once you do have that diagnosis, it's very common to get at least yearly testing done to make sure everything is, your medications are still working and everything's still holding strong. Okay, so what to expect during a spirometry? Okay. So what happens during the test? So during a test here on the Sunshine Coast, it will be myself or Rosemarie. We also have another colleague who just joined us named Kelly. She wasn't able to make it tonight, but she's another respiratory therapist like myself. So we are going to mostly be taking charge of performing the spirometry. So you will likely be seeing one of us in the future if that's what you are being referred for. So during the test, we will have a quick chat with you, you know, what sent you here. If you're taking any breathing medications, we will have you sit in a chair next to us, and we will conduct you through what the spirometry is. So you're going to be taking your biggest breath in, filling your lungs as much as they can, blasting that breath out hard and fast, and squeezing until you cannot possibly squeeze out anymore. So it is a very effort-dependent test. It is a little bit of a pain in the butt to some people. So you'll be squeezing, and from that we can get your results. So are there any side effects? There are a couple of side effects from doing a spirometry. The most common one is while you're performing the test, it's quite common to get a little bit dizzy or lightheaded. So just as much as you would blowing up a balloon, I don't know if you've ever had to blow up a few balloons for a birthday party, but if you ever have to sit and take a break and give me a minute, you get that dizziness, lightheadedness. It's the same feeling when you're doing a spirometry. All that really big, heavy, blasting breathing that can make you a little bit dizzy and lightheaded. It can also give you a little bit of chest discomfort, a little bit of chest tightness sometimes, and just in general, just fatigue. Can I still take my medication that day? So the end all be all is yes, please take all of your medication as scheduled, with the exception, if possible, of your breathing medications. So anything, your diabetes medication, your heart medication, all that stuff, we want you to take as if you weren't even doing a spirometry test. If possible, it is really helpful to have your lungs have none of the inhalers. And I do want to stress, if possible. So if you are one of those people who heavily relies on your inhalers and you can hardly make it up the stairs without using one, please continue using it. And we will just make a little note in the test that reminds the interpreting physician to sort of interpret it with a grain of salt and work around the use of your inhaler. If you're able to not take your inhaler for a good 12 hours before the test, depending on which inhaler you're using, it is a little bit best for diagnosis. So how long does the test take? Usually takes about 20 to 30 minutes. And you can go about your normal day after that. You don't have to have anybody drive you home. It's just status quo after. Tips for success. So the one big thing that I really would like to drive home about doing a spirometry test is it is very, very effort dependent. So it's, for the most part, 99% of people, they're there, they want to find out what's wrong. They do put their best effort in. Unfortunately, sometimes people have a really bad cough and it is so hard for them to blast that breath out without coughing. Sometimes that will skew the results and make it a little bit less accurate. But the doctors, they do their best to sort of interpret around that. You really do have to fill your lungs up and blast that breath. You got to use your tummy muscles. You got to use that diaphragm, squeezing. We always ask you to blow out for way longer than you think you need to. So you got to try to resist that urge to take a breath in so we can get the full results. But just trying to stress, that it is extremely effort dependent. I'd say that the most difficult I have testing are usually the teenage crowd who, they don't really want to be there. They kind of half their efforts, but for the most part, it goes over pretty well. Okay, so what happens next? So how do I find out my test results? So once we perform the spirometry, we send that to a specialist to get interpreted. So they look at all the results, they compare them to normal. So normals are calculated based on your sex, your height, and your weight. And so they will come up with values, say what's not normal, what is normal, and then they will send the results back to your referring physician where you can make a follow-up appointment to go over those results. The therapist who is performing your test is not able to give you the results from the test. Will I need medication? So a part of the spirometry is we often will want to see if you have a response to something called a bronchodilator. So a lot of you will have seen the handy blue inhaler, whether you have it, a friend has it, or you've seen it in a movie. It's very, very common. And part of our test is we will get you to do the deep breathing, the big breath, the blasting out. We'll get it a few times so we get an accurate number. And then we're going to give you a few puffs of that blue inhaler to open up your lungs. And we're going to get you to repeat the test. to see if there's a substantial difference, if you have a benefit from that puffer or not. So that's the only medication that we may or may not give you doing your spirometry. Also want to drive home that you guys are in the driver's seat. If you do not want to take an inhaler, if you've taken one before and it has not made you feel good, you do not have to take it. We can just do either the first half of it, or you don't even have to perform the spirometry if you really don't want to. Will I have to retest? That depends. So if that day that you came in happened to be a particularly bad day for you, and you were coughing more than normal or more short of breath, you can always come back, a few weeks later and redo the test with your doctor's permission. Also, based on the results, you might have to go for secondary testing. So it really does depend. That will be prompted by your doctor. What we are able to do on the coast here will just be the spirometry. There are other breathing tests that are more specific depending on what your breathing disorder is. So you may get referred back to the Lower Mainland for more definitive testing if the doctor sees fit. Okay, so when should a spirometry not be done? So there are certain instances where we just really should not do a spirometry. So we have a hard and strict rule. We will not do any spirometries or any breathing tests, for that matter, within 2 months of any chest, stomach, brain, or eye surgery. That is just for your safety. We want to make sure everything is well healed before we're making you take in big breaths and blast them out, okay? Within 2 months of a pneumothorax, which is a fancy word for a collapsed lung. Again, just making sure things are healed. Within 1 month of having a heart attack, which I actually believe that it's been updated, hasn't it? It's just 1 week now. So 1 week of a heart attack. We prefer erring on the side of caution. We don't need to be doing a spirometry a week after you had a heart attack, so we'll wait a little bit longer. If you're actively coughing up blood, and if you've had any sort of aneurysms, we just want to make sure that you're at your healthiest and at your baseline before we're performing a spirometry. And the last drive home is a doctor must have a good reason to refer you. A lot of people there just, plain curious on what their lung function is, but we really do need to save our spirometry spots, being that we know they're going to get filled up very, very quickly for people who really do need the pulmonary function testing done.
Just with regards to the resources page, again, lots of reliable online resources, asthma.ca, and the phone number there is for a certified respiratory educator specific to asthma. The Canadian Lung Association has so much information on it, but of special note, they do have virtual pulmonary rehab available to anyone who wishes to do that kind of a program themselves. And they also have certified respiratory educators for all lung conditions. So there's excellent information. If you're interested in quitting smoking, quitnow.ca is an excellent resource. And they like to present in many different forums. So you could sign up to get email blasts, encouraging words. You could give them a call. And also, the province does provide free nicotine replacement to people who are interested in engaging the process, and just to basically give your brain what it desires without injuring your lungs in the process. So there are good resources for people who are keen to pursue them. And sometimes we're not quite at that readiness phase, and that's okay. Wherever you are in the journey is absolutely fine, but keeping an open dialogue with your physician is the best way of knowing what is the next step and what is the best resource to refer you on to. So thank you very much for this time.